Hello everyone, my name is MEERIM Karagulova and I'm a teacher of Satkynbay Tentishev Memorial Asian Medical Institute. In Asian Medical Institute, we are guided by ideology of high quality and pure education. And it is very important in training future doctors because being a doctor is one of the most difficult, important, and at the same time noble professions. In future, you will have to save the most precious thing your patients have, their health and lives. And in order to become a good doctor, good professional in your field, you must work hard now. Continuously every day study well to deepen your knowledge, to acquire new skills and improve them to perfect. Okay, today we are going to talk about Latin language. What it is, the history of Latin language, and the role of Latin language for medicine. Not a single people in the world speaks Latin nowadays, but in the history of world civilization, the influence of the Latin language is not ceased. The history of the Latin language dates back to the beginning of the first millennium before Christ. Since period includes the first information about the tribes of Latins. They lived in the area called Latium, and their language was Latin. By the end of second century before Christ, a huge Roman Empire was formed. The state language of the empire was Latin. It spread through official institutions, as well as through the communication of the local population with Roman soldiers, merchants, and settlers. Despite the fact that the inhabitants of the occupied territories learned Latin through live communication with the invaders, Latin for them was not only a forced language, it also became a conductor of a higher culture, which opened world of science for them. In the history of the Latin language, there are following stages of development. Archaic period, from the first surviving written monuments dating from about the 1st century BC, which were inscriptions on weapons and other personal belongings. The Classical period, which is known as Golden Latin, 1st century BC and the beginning of the 1st century AD. Why it is called as Golden Latin? Because exactly in this period, the first medical schools were created in Rome, and Latin began to develop very fast. Third, post-classical period, Silver Latin, 1st and 2nd centuries AD. Late Latin belongs to 3rd to 6th centuries AD, a qualitatively new phase in the development of the Latin language. The development of all sciences contributed to the development of scientific Latin, among which biology, medicine, and veterinary medicine occupy an important place. As a result of scientific researches, the Latin language had been continuously enriched with new words, terms denoting certain concepts of science, technology, production, etc. It was the Greeks and Romans who created the first works on medicine. Ancient scientists proposed the first classifications and terms, many of which we still use today. In the second millennium before Christ, the Romans conquered ancient Greece, and faced a state that is more developed in all respects. Greek medical terminology already existed there, the foundations of which were laid by Hippocrates. He not only created the famous Code of Ethics, which is known as Hippocratic Oath, but also became the creator of medical terms that have passed through the millennia unchanged. Some examples like gastro, Greek designation of stomach, derma, skin. Starting from this period, medical terminology began to form on a bilingual Greek-Latin basis. It means that the same anatomical formations are designated in the anatomical nomenclature by Latin words and in the clinical nomenclature by Greek words. Aulus Cornelius Celsus, author of works in 8 books entitled On Medicine. Celsus, in his works, not only explained the Greek terms, but also gave the most accurate equivalents in Latin. The works of the Greek philosopher, scientist, and physician Claudius Galenus of Pergamum are about scientific and practical issues of anatomy, etiology, and treatment of various diseases, as well as the preparation of all kinds of medicines. Galenus compiled a special dictionary for the works of Hippocrates and introduced the names of a number of dosage forms and drugs into medical terminology. In the Middle Ages, Arab scientists made a significant contribution to the development of medicine. The great physician of the East, Ibn Sina, whose work Canons of Medical Science was translated into Latin in the 12th century and was very popular in Western Europe. Medieval Arabic medicine and chemistry had a significant impact on European scholars. During this era, pharmaceutical terminology was replenished with Arabic words like alcohol, elixir, syrupus, etc. Andreas Vesalius did a lot to improve and clarify Latin anatomical terms. In the book on the structure of the human body, he summarized and systematized the achievements in the field of anatomy. The book contains a thorough study of the organs and the entire structure of the human body, since Vesalius dissected human corpses to illustrate his words. William Harvey made a great contribution to the development of physiology, who discovered blood circulation and wrote his famous treatise, Anatomical Study of the Movement of the Heart and Blood in Animals. The pinnacle of artificial plant classification was the system developed by Carl Linnaeus. Linnaeus introduced the binomial nomenclature according to which each plant is defined by 2 Latin names by its family and species. In the Middle Ages, with the flourishing of universities, the role of Latin as the international language of science increased. The Latin language was the means of communication that allowed scientists and students from different countries to understand each other, communicate effectively, and learn. Much time passed Much time passed since antiquity, but Latin is continuing to remain the basic language of medicine. By the way, this is one of the richest terminological systems, the collection of which is nearly 500,000 terms. There have been many attempts to change international medical terminology. There were attempts to use English, French, German, and other languages, but the position of Latin remains unshakable due to the peculiarities of this language. Which peculiarities, you think? Now we will discuss them. Capacity and conciseness. In one word, you can express what in other languages will have to be denoted by several words. For example, keratitis, inflammation of the cornea of the eye. See, keratitis, one word. Inflammation of the cornea of the eye. How many words? Of course, it is easier to use keratitis. Consistency. Thanks to its well-formed logic and the presence of numerous suffixes and prefixes with a clear meaning, the possibilities of Latin language for classifying and describing diseases are almost endless. Next peculiarity is structuredness. Parts of a Latin word, prefixes, roots, and suffixes, keep the same meaning in different words. So it doesn't matter how complex structure clinical term will have, if you know the meaning of its elements, parts, you will easily understand the whole meaning of term. Next peculiarity is versatility. For generations, medical students around the world have been learning and using Latin in their works. The long-standing practice of using the language unites doctors around the world, contributes to the unification of medical literature and education in general. In their daily work, specialists from various branches of medicine are facing with the Latin. Almost constantly, when reading anatomical and clinical terms, describing diseases, medicines, writing recipes and chemical compounds. Thus, Latin became the international language of medical profession, and the pharmacists used the prestigious scientific symposia and in serious journals. Therefore, despite the fact that Latin is called a dead language, it is a language necessary for daily work of all medical professionals. And that is why we have a famous saying which about in via est in medicina, via sine lingua latina, which means there is no way to medicine without Latin language. So today I described you brief history of Latin language development and tried to explain why Latin language is important for medicine and why medical students are studying Latin.